Good evening and welcome. I'm Dr. Barry Levine. I'm a board-certified dermatologist and I'm the owner and medical director of Refined Dermatique Aesthetic Center. Thank you very much for attending our virtual event tonight. We greatly appreciate you taking the time to join us and listen, and we're very excited to have you here. The event is twofold. One is we get a lot of questions about our lasers. Which laser does what do the names stand for? So we're going to try and spend a little bit of time tonight just going through those basics, because I think once we explain them, they'll be easily understood, and it'll make a lot of you feel a little bit more educated and less anxious about some of these systems. The second is that we have a new laser that we're adding to our aesthetic center. We're very excited about that. So we're going to introduce that, discuss that tonight. And then we also have one other device that we're adding into our aesthetic center that we're going to mention. And we're also very excited about that, to expand that into our clinic. So thank you very much again. And without further ado, let's start our talk. Before we start talking about laser systems, we really need to talk about skin for a few minutes and how we age, because that's important to understand how our skin and structures change as we age that make us look older. So if you look at a person as they age, there are many things that change, but there are a few factors that really make us start looking older. We start losing collagen and elastic tissue in our skin, so we don't have the support like we did when we were younger. We start losing some of the fat in many of the areas of our face. And we also start losing some of the bony structures. And what happens is we then start losing some of that 3D support that we have in our face. And as time goes on, instead of being that nice, fully filled type face, we start hollowing out along the temples and along the cheeks. And as you can see, that whole facial structure changes. When we start losing volume in our mid-face, we start losing that 3D structure, and that's when we start getting these so-called jowls. That's normal aging. Anything we can do to try and slow down that aging process will help us to continue to look younger. The skin itself really changes as we age. And as you look at the skin in somebody that's in their 30s, you notice that they have a nice, thick epidermis. They have a very strong attachment between the dermis and the epidermis. The dermis itself has nice, what we call lattice structure. We have good support underneath there. And if you look at a cross-section of the skin, we have just an abundance and nice cross-hatching of our collagen, elastic tissue, and some of the other molecules that supply support for us. As we start aging, however, that skin starts thinning out. This attachment along the dermal epidermal junction starts weakening. This tissue down here starts breaking down. The collagen and elastic tissue, we don't have as much. It's not cross-linked as tightly. So we start losing some of that support. And what happens then is you start seeing some of these changes with the so-called wrinkles or rhytids in the surface. This continues to get accentuated as we move down into our 50s and our 60s. And as you can see on the last schematic, that the skin is definitely thinner. The support structure is definitely weakening. It's not as cross-linked, and we're just losing collagen and elastic tissue as we age. So what we're trying to do is we're trying to combat that. We're trying to help slow down the aging process. We can't stop it, but we can definitely do some things to improve that. One thing that's really important is that there are external factors that accentuate that or speed that along. And one of the biggest things is sun exposure. So chronic long-term sun exposure accentuates that entire process. It speeds it up. And all of you know people that spend a lot of time in the sun and they're not careful. They always start looking older than their peers as they start getting into their 30s, their 40s, and their 50s. Now, there are a few things that happen. Number one is the UV light does stimulate the melanocytes down in the epidermis, and that will cause them to start making some abnormal pigment. And you'll start seeing brown, tan, darker blotches that start appearing on people's skin. That's usually from sun. Now, hormones also play a role, but sun is a big factor. It also markedly increases your risk for skin cancer as well. And as a dermatologist, that's extremely important to me. So I tell all my patients on the clinic side that the positive side effect of wearing your sunscreen and wearing your hats and being careful in the sun is not only to reduce your risk of skin cancer, but you're going to look younger when you're older. So I think that's a great side effect. So the sun plays a huge role, but also there are other environmental factors that play a role with aging the skin. Smoking is a big one. Diet. If you eat a very healthy diet, rich in antioxidant food, it will help you significantly. And also staying hydrated and maintaining your weight. Those are all healthy lifestyle things that you can do to help slow down the aging process. So I think all of those things are important as you try and look your best. There are a few key things that I would like to just touch on before we start talking about lasers, because I think when you look up lasers and you start reading about the different types of lasers, it can get very confusing very fast because there's all kinds of different systems and different nomenclature and different wavelengths. But I like to look at things very simply. And what I like to do is break it down into ablative lasers and non-ablative lasers. And what I mean by that is ablative lasers are lasers that vaporize or disrupt the epidermis. And you remember from the schematic, the epidermis is that outer layer of skin. When you vaporize or disrupt the epidermis, you will have more downtime, period. So that's ablative lasers. Non-ablative lasers do not disrupt the epidermis. So you're not vaporizing or punching holes in the epidermis. Therefore, you'll have less downtime. Now, they're both important. And some lasers, as we'll see, can have both functions. But that's important because when we're planning laser procedures in patients, it's important to know how much sun damage they have, how much downtime they can afford to have. So as a general rule, non-ablative lasers usually aren't as aggressive as ablative lasers. So if you came in and you were 80 years old and you really wanted to improve your skin, most likely we would need something that's a little bit more aggressive along the ablative line. The other term that I just want to mention, we're not going to go into detail because it gets real confusing, is when you're reading about lasers or looking up about laser terminology, you'll see fractionated or non-fractionated. And I just want you to be aware of that. Fractionated means that it's not entirely treating the entire surface of the skin. It's treating little small microcolumns or pixels. If you're doing a non-fractionated laser, it's treating the entire area. And you don't need to understand all that or go into great detail about that. But when you're reading that, you'll see those terms. And if you don't understand them, it gets confusing. So I think if we look at it simply with ablative versus non-ablative, it's easier to understand the downtime. Tonight we're going to talk a little bit about the Cyton family platform laser. We have that in our facility here, and we have multiple lasers off of this platform. I've been using the Cyton systems for about 16 years now. I do have other lasers as well, but tonight we're going to be talking about these. And I get a lot of questions about the different names. Specifically, I get asked all the time about the BBL Hero versus the Halo. It's confusing a little bit with the nomenclature, so I wanted to spend a few minutes talking about that, because then I think it's easier for people to understand, because if you're starting to throw out terms, it's confusing, they don't understand. So we're going to spend a few minutes tonight discussing those. And actually, sometimes it's scary to think, well, I'm going to have laser. So we actually have a few demos that we're going to show, and I'll talk you through, and I'll kind of tell you what the experience is like. And that kind of takes a lot of the fear and the anxiety out. So we'll first start talking about BBL. And BBL stands for Broadband Light. It's a light device, and it's an array of wavelengths. And we can specifically adjust the spectrum of wavelengths with different filters. And we have multiple different filters. And by using those filters, we can adjust for certain skin types or for targets in the skin. So it's a great modality. Now, just as an aside, I have been doing BBL treatments for approximately 16 years. Last year, they came out with something called BBL Hero, which was the next generation of BBL. It had double the cooling system, and so we're able to put in 3 times the energy of what we used to. And I can tell you that we've been doing that now for approximately a year. We love the system. It is much more comfortable. I think we get better results. Our patients have absolutely loved it. So it is a treatment that we can use on the face, but we can, with the Hero system now, it's much easier to use it in other areas. Neck and chest are real common. We can do hands, arms. We've done legs. We've actually done full bodies. And so it's a wonderful new modality. So when you come into the office, first thing we do when we're doing Hero is we make sure that all your makeup, moisturizer, sunscreen, everything is off. Your face is cleansed. We pull your hair back to make sure that it's out of the field that we're treating. We then put a headband on you, and we also put eye protection. So anytime you're going to have a laser procedure, a light device procedure, you have to have eye protection, not only the patient, but all the staff. With the BBL, we then use a clear ultrasound gel on your entire face, and we put this all over the face, and it works to help cool the skin with the cooling mechanism to prevent problems, but also helps a light energy into the skin. And this is a motion technique, and we follow an anti-aging protocol, and we can customize that. We actually got Dr. Bitter's anti-aging protocol, and we follow that. But if people have more reds for rosacea, we come back and we can treat those areas extra. If people have more freckles or brown areas, we can go back and treat those as well. So a treatment like this, there's some mild discomfort. It's not bad, a little bit of warmth. It takes approximately 35 minutes or so to do an entire face. It's comfortable. There's no downtime with this procedure. You may look a little bit windburnt, sometimes along the cheeks for a few hours. If we raise a lot of the pigment up, the browns, they'll be present for maybe 10 days or so. It's extremely important that you use good sunscreen afterwards, and that's a must. We put sunscreen on you before we leave. So during the procedure, as you can see, she's chuckling on this one. I'm a talker, so usually we're talking and having a good time. So, and again, we can use it off the face, we can use it neck, chest, various areas. So that is a BBL Hero procedure. And we have different hand pieces and different filters, and it just shows me treating the forehead, but we treat the cheeks, We make extra passes around the lips, the nose, as well as the eyes. And this would be one of our patients. As you can see, this patient had 2 treatments. Generally, we do what we call a corrective series, which are 2 treatments, and we try and do those about 2 to 3 weeks apart. And then we do maintenance, and it depends on your age, but we believe that maintenance is important. As you can see, just from 2 treatments, you can see the changes. The browns are markedly improved. You can see some of the vessels are significantly improved. The radiance on these patients is markedly improved for most people. And they'll just say that their skin action, we have chats about that a lot. But I also believe that good basic products, and we guide you down that path before and after, not only enhance but maintain your results. And that's important to you, and it's important to us, so we talk about that. But I can assure you that this is a happy patient. This one is just an example. We can do other areas, and this is actually a plastic surgeon from Florida. And this just goes to show you how much sun damage people can get. This is called poikiloderma, where they get marked reds and browns along the chest. Not uncommon in this area. And I believe this person had 1 treatment. Now that's an unbelievable result in 1 treatment. We don't always expect that. But we can definitely improve not only the reds, the browns, but the skin texture. It'll feel smoother and it'll look brighter. Now the chest and the neck can feel a little bit warmer after treatment than the face, so we have to be a little bit careful with the energies on that. But again, once you get it in improvement, you need to protect that. And so I'm big on sunscreen, but I'm also big on people that have a lot of sun damage on their chest and wearing UV clothing. So that's the BBL, Broadband Light, non-ablative, no downtime. You may look a little red in the cheeks for a few hours. The browns can last about 10 days. It is a great treatment to use on any body area. There is no downtime, like I said, but also there is evidence with a DNA study to show that not only does it slow down the aging process, but it reverses it. And so we're big on, once we get it corrected, to make sure that you're wearing your sunscreen, using good products, and we do maintenance treatments. And I think the longest patient I have currently that's been doing BBLs with me is 16 years, and she looks fantastic and she's happy, and those are fun patients. So that was the BBL Hero. Now we're going to talk a little bit about the Halo. So that's another laser, a different laser. So this is what we call a hybrid laser. It's interesting because there's 2 different lasers in one. We have an ablative component and we have a non-ablative component. So we have both. That's unique. That's not common. But what we have found with that is that we get better results when we're combining the 2, and we get a little bit quicker recovery. So it is a laser that has been around for several years. We can use it almost anywhere on the body, but the face and neck are the most common. Because it's ablative, there's downtime with this laser. This is not a laser that you come in and you have it done and then you go right back to work. We have to plan this where you have some downtime, and depending on how we set the parameters, that can be anywhere from 2-3 days, and you know, if we're very aggressive, that could be up to 5 to 7 days. I'm also very picky about sun protection prior to. We have some products we want you on. Before and after, we give you a kit, because there's a little bit of downtime and a little bit of wound care with that as well. But this is